I'm Dr. Jeff Selano from Advanced Regenerative Medicine and Colorado Knee and Spine Clinic, and we're going to do a demonstration today on Annabelle for a thoracic adjustment. Annabelle's an athlete. She's been a dancer for many years, and as such, she's got good muscle tone. She's in good shape, but you can see that she's pretty petite. And I asked her if we could do this demonstration on her because I want to show that it doesn't take a lot of power and a lot of force. The adjustment might look the same as if I was adjusting someone who was 300 pounds. The technique and the force is going to be completely different and a lot lighter. So I just like to mention that because a lot of times smaller women might think, why I couldn't have someone 220 pounds adjust me that way because it might make me feel uncomfortable. So we're going to talk about all that stuff. I'm going to demonstrate what we do. So first thing is just a little range of motion. So cross your arms. This time we're going to be focusing on the thoracic spine. So just lean forward for me. Okay, and then rotate this way. And I'm just going to have you come back. And I'm just feeling my way with my thumb down her spine and just checking to see if the vertebrae are moving independently from one another a little bit. I mean, they are connected by the discs and the ligaments and the ribs. Let's go this way. But I'm checking to see if there's any vertebrae that are stuck together and are moving as a block, or there we go, right there. Okay, very good. So first thing I'm going to have her do is lay on her stomach. Because Annabelle is wearing a skirt, I'm going to cover up her lower body here just to make her feel more comfortable, even though she's got stockings on. Full disclosure, Annabelle is my daughter, but if it was another woman that was here, we would do the exact same thing. So the next thing we're going to do is just palpate, and I want to find where that vertebra was that was stuck. And typically, if it's going to be rotated to the left, then those paraspinal muscles are going to be bunched up on the left side versus on the right side. And we found it right there. Now, for a lot of women, laying on their stomach, I was taught how to adjust by a woman, so I was able to have someone talk me through this part of it and be sensitive to women's anatomy different than a man's. If she's laying on her stomach, then I'm going to be potentially squashing her chest into the table, which can be very uncomfortable for a woman, especially I'm just using a flat bench. There are tables that are made and there are devices that a woman could lay on that have a little bit more padding, but there's a way that we can work around this, and I'm going to show you both ways. I like to give the lady the option. You'll see why in just a second. But the adjustment is pretty simple. You just set up, and Annabelle, take a breath in and blow all your air out. And I'm just going to come forward and just a little impulse at the end. It's not very hard at all. Now in that case, I didn't get anything to move. It was just demonstration purposes. But you noticed that instead of coming straight down and squashing her into the table, I'm trying to come forward at a 45-degree angle, which is how those facets between the vertebrae are riding anyway, and try to come through her shoulders and eliminate as best I can squashing her into the table. So let me show you the other way. If you will, roll over on your back, and we'll keep her covered up. You comfy?
No.
Okay. So I'm going to have Annabelle put her hands on the tops of her shoulders and crisscross her elbows, bring her towards me, and then again I'm just going to palpate and find that spot. And in this case, take a deep breath in, all the way out. Now if I do the adjustment and I come straight down, we're really not accomplishing anything different because I'm squashing her chest. So I'm going to use her shoulders and try to come forward at that 45-degree angle and get the same thing done without making her feel uncomfortable. So deep breath in, all the way out. There you go. There it goes. Awesome. Okay, come on, sit up. Swing your legs around that way. Okay, cross your arms. All right, now I'm just going to, again, feel for that stair-stepping feel between the vertebrae. And I'm just walking down with my thumb. Yeah. Tip that way for me. Yeah. Okay, so the misalignment is now free, which is great. Relax your arms. And that is a thoracic adjustment. There's basically just two ways to do that. One is laying on your stomach and one is laying on your back. So I always ask which one the patient would be more comfortable with. And in the case of warmer weather and we have a skirt, something short, we're always going to use a gown. In that case with the lady. So I think that's about it, and thank you guys so much. Please subscribe, make sure you hit the like button and hit that bell so you can get future notifications. We got lots more videos that are coming, and a big part of what we do is regenerative medicine, but we're focusing first just on some chiropractic things, but we've got a whole bunch more regenerative videos coming for you as well. So we look forward to that. Thanks, and we'll see you next time.